You are listening to CalmUnity Global Internet Radio. I'm Dian Kiser, and welcome to Observations and Perspectives. Today, we are going to talk about anti-racism. Those of us who benefit from white privilege really have a moral duty to see the unfairness in racist policies and work toward recognizing and changing those policies. We know that policy change takes time, but slowly, these policies are working, and we want to evolve into another type of country that is inclusive, not exclusive. Our guest today to discuss the issue of anti-racism in public health is Vicki Karnes. Vicki is a retired registered nurse and health educator from Atlanta, Georgia. She is also a social justice advocate. Both Vicki Karnes and I are white women in our 60s and 70s who have had professional careers in public health policy, both part-time and full-time. Vicki, thank you so much for joining us today. And let's take a look at the subject, anti-racism. So what is anti-racism, and how can we become anti-racists?
Well, Diane, I want to begin with a heartfelt thank you to you. We began this conversation 6 months ago about what it means to be an anti-racist, and I've learned so much. I've come to believe that becoming an anti-racist is a journey, and that journey is about taking action to reverse racism wherever we find it. Let me start with this definition of a racist by professor and researcher Dr. Ibram X. Kendi, Kendi. He is the author of the New York Times best-selling book, How to Be an Anti-Racist, right? Perfect. So Dr. Kendi says that a racist is simply a person who expresses racist ideas or supports racist policy. And well, you could say that there are active and passive racists. To illustrate, let me share a word picture that Dr. Beverly Daniel Tatum, the former president of Spelman College in Atlanta, had created. And that is, imagine that you're on a moving sidewalk. Now, you may have seen these at big airports to get people from A to B over long, but it's like a human conveyor belt. An active racist is someone who walks, often briskly, to the left of the sidewalk, okay? While the passive racist stands to the right and basically is being taken to the same destination as the active racist. The anti-racist is the one on the sidewalk, moving sidewalk, who turns around and starts walking in the opposite direction faster than the sidewalk is moving. So basically, an anti-racist is going to bump into a lot of people and disrupt the status quo. Okay. So in the next few minutes, I'd like to talk about, say, 3 steps we could take to get started on this journey. I'd like to share a personal experience related to the COVID-19 pandemic.
Okay.
And I'd like to describe the plan that I've come up just this week to address a crisis that is unfolding in Atlanta. So to begin, what are 3 steps that we can take to get started on this journey? I'm going to quote from Dr. Kendi again. And Dr. Kendi believes that the heartbeat of racism, and this is his words, is denial. And that the sound of that heartbeat for an individual is saying, I'm not racist. So step 1 is to stop saying, I'm not a racist. And by doing this, we are not sharing the words that we hear from white supremacists. I'm not racist. Okay, so step 2 is to accept that our upbringing as a member of the white dominant group in this country has led us to be blind to racist ideas and racist policies. So part of step 2 then is to recognize the racist ideas that we express and the racist policies we support. And the third step involves action. And it's basically not something we can perfect. It's the struggle to look at things differently, to change how we think, to include more anti-racist ideas, and also to work with others to create new anti-racist policies that will benefit Black, Indigenous people, and people of color. Okay, so that's, I haven't really described what a racist idea is, but I'm not going to spend all afternoon here. I might go off script and just start rambling. So the personal experience that I'd like to share is related to the health disparity, or the different impact of COVID-19 pandemic that has had on my colleague and I. We've had totally different experiences. My colleague is a Black woman, a health educator with a specialty in health literacy. She's a mother and a grandmother. And she is active in her church and has attended the annual National Women's Conference that her church has held for over 10 years. So it was an eye-opening experience for me to learn that she knew or was personally connected to 100 people who died from COVID-19. On the other hand, I did not know, or I was not connected to one single person who died of COVID-19. So how did racist policies ultimately affect this striking difference? So for one, many Black adults were less likely to work from home. They were often frontline workers providing an essential service, so were more at risk of being exposed to the virus and developing COVID-19. Another reason, many Black adults do not have a primary care doctor in this part of the country. And in Georgia, I say part of the country meaning the Southeast United States. And in Georgia, many Black adults are uninsured. Now, this is directly tied to a policy decision to not expand Medicaid under the Affordable Care Act passed by President Obama and his administration, a policy to not expand Medicaid that our governor and his fellow Republicans have made. So there's over 500,000 adults in Georgia that do not have health insurance, where they would have had an opportunity in other states to sign up for Medicaid. And another reason is many Black families live in communities that are known as trauma deserts. And I'll explain what that is. A trauma desert is an area that lacks the highest emergency room designation of being a level 1 trauma center. So that's the highest designation. Deal with strokes, the highest, the most serious emergencies. So many Black families do not live near one of those hospitals, especially in Georgia. So I guess if you think of anything you want to chime in, please, I invite you to do so. But,
thank you. I don't want to interrupt you, but the period of time where you had identified you had lost 0 people with COVID and your colleague had lost 100 people to COVID, what was that time frame?
Well, during the worst part, even after vaccinations, people were still being exposed, or who had serious other medical conditions. So, for example, in Georgia, we're one of the states with the highest level of hypertension, strokes, heart attacks, diabetes. And that has to do with the availability of health care. Part of it is. Even, I mean, it's just all spectrums of life. Pregnant mothers may not survive their pregnancy. The babies may not survive, etc. So that's one. It's especially here in Georgia.
Yeah, I was just interested in.
We have an opportunity.
Yeah, absolutely.
So, and then let me see. So this is the third area I want to talk about is what I plan to address, how I've been moved to take action. In other words, I've seen this unfold over the last 9 months, and I've been shaking my head. And it's like, I don't like that. This is not good. But it wasn't until the last 2 days that I've said, I took a stand and I said, you know what? This is not okay. I got angry. This is not okay. I've got to do something about this. What can I do? So the situation that has unfolded in the last 9 months here is that 2 major hospitals have owned by 2 major hospitals. They're owned by a nonprofit hospital healthcare system, have closed their doors here in Metro Atlanta.
Oh my God.
Now, to give you a perspective, in the last 10 years, 8 hospitals have closed outside of the Metro Atlanta area. So Metro Atlanta basically has 5 million people, and the state of Georgia has a little more than twice that. So 8 hospitals serving the rest of Georgia were closed. So this is a shock to our community. I could call it a disaster, a man-made disaster, because in the spring, when one of this hospital group announced, they said they were going to close the hospital in 60 days. So then in August, the same group made another announcement and said, oh, by the way, we're going to close the biggest hospital. It's been around for 110 years in Metro Atlanta. I say the biggest. And it is the hospital with a level 1 trauma center.
Oh my.
So now in Metro Atlanta, we have 1 level 1 trauma center serving 5 million people.
Are there any groups that are monitoring this and any alliances that are looking at health alliances?
Yes, of course. I mean, there's all sorts of groups that were already interested in this. Even Senator Raphael Warnock held a town hall meeting, bringing people together to talk. Now, who shows up? Who shows up for those meetings? People have already been wanting to improve the healthcare system. Leaders in the industry, community health organizers, nonprofits, all these people show up. But one of the complaints that was made by the local chapter of the NAACP, the National Association for the Advancement of Colored People, has been, these people are not being affected. It's the people in the community that they need to be part of the conversation.
Right.
So the idea is, well, how's this impact? So in 10,000 adults will lose their primary care doctor. They have to go find another 10,000 adults to go find another doctor. And every month, over 8,300 people who have to go to an ER will have to go to one of the other ERs in Metro Atlanta, which there's only about four or five. There's only one trauma center, but right. So 8,000 people are going to have to go to the other emergency rooms, which are already suffering from overcrowding.
So a
And
third.
then, like I said, one of those two hospitals had the highest level of trauma emergency room. So that's going to affect 5 million people. Now, let's take a look. I don't have statistics for the 5 million people, but in the city of Atlanta itself, 52% of the population identifies as Black or African American. So city of Atlanta has 500,000 people. 52% are Black or African American, which is pretty high, probably the second highest in the country. Maybe New York City maybe has higher. But a city of Atlanta, 52% are Black or African American. So you see how this man-made disaster has not affected everyone equally?
Yes, yes. You can see where the impact is going to go.
Yeah. And I'm going to digress a little bit from my notes, but part of where I'm going with this plan is that I have already volunteered to be the disaster preparedness lead for the state of Georgia group of diabetes educators. So we know that during natural disasters or man-made disasters that people with chronic illnesses are more vulnerable.
Absolutely.
So I thought, well, since I'm already said I wanted to do this applies right here.
Yes. Absolutely. Absolutely.
So, and there are steps in disaster prepare is understanding, the first blow, it's a blow to the community. It's going to take 10 years to
it's 1/3 of your hospital beds are gone.
Well, the hospital beds, yes. We didn't even talk about the beds, the urgent care, the primary care
emergency
doctors.
rooms, all of that. Absolutely. Right. Yeah.
So it's going to take 10 years to recover from this.
Yep.
And the idea that I have about policy is that it may 10 years to come about is that no hospital should be able to say, no nonprofit hospital, which receives money from the federal government, should be able to say, I'm going to shut down in 60 days.
Exactly.
Right? That's the long-range policy.
Totally out of line.
Right. But in the meantime, what I'm going to do is I've already created an extensive list of health centers that serve those that are uninsured or underinsured. So I'm going to update the list, expand it. And who needs it? The people being affected. So Metro Atlanta has a concerned Black clergy organization. So I'll start with the churches that are right around the hospitals that have closed. and I'll bring that information to the pastors, and we'll ask them if they'd like it. And if they would, say, I'm here to support your congregation to be connected to healthcare.
Yeah.
So
What a gift that is, Vicki.
I
That's
really see,
perfect. That's
I
a
see it.
wonderful thing. Yeah.
It's practical. It's a talent I have,
Yes.
I
Yeah.
mean, so I guess my hope is that in our conversation, I've helped raise awareness
Yeah.
about what it means to be an anti-racist. And I would encourage, I'm looking at the time, just the idea, I would encourage CalmUnity Global Internet Radio listeners to search the internet, find videos, and hear the words of Dr. Ibram, Ibram, X is his middle initial, Kendi, Kendi, and hear the words of Dr. Kendi for yourself.
Wonderful.
That's my hope, and I would encourage all the listeners to do that.
Thank you so much. That is a fabulous closure. And I want to thank you, Vicki, for your contribution to a topic that we both have been interested in for decades, I think, but that we're just beginning to address. Anti-racism is here to stay, and we can have a part in the actions and outcomes of making this society really more accepting of our citizens that may have different beliefs, origins, or ideas. I'm going to briefly share, Vicki, one of the areas that has bothered me for the last 2 decades. And you mentioned the word earlier and it's the word that bothers me, and that's denial and deniers. One of the areas of racism I have personally found abhorrent have been the lies, the cover-ups, the conspiracy theories, denial and distortion of facts, such as the denial of slavery, or the denial of the Holocaust, or any attempt to negate established facts about slavery, the Holocaust, or other important historical events. And this is an assault on truth and understanding. It is important for all of us to understand that certain groups of individuals have been unfairly treated and targeted, and that has to stop. And many of us believe it will, not immediately, but the change we have seen in the past 70 years have been remarkable. As a young person of 17 growing up in the very white town of San Carlos, California in the 1960s, I was shocked to find out a few years later that realtors had taken a pledge not to sell any type of property in San Carlos, California to any person of color. That was painfully apparent as finally the first African American was able to buy a home in San Carlos, California, and that was Willie Mays. So Willie Mays, and that was in the 70s, Willie Mays was able to buy a home. And I had been told that it was totally an economic issue, and I found out that it was not an economic issue. And that discovery set in motion many negative things that I had been told about African Americans that were simply not true. So my little bit of advice to our listeners, and it's really not more than advice, it's heartfelt, that try to experience things for yourself. Don't buy lies. Thank you so much for listening to this program, and you're listening to CalmUnity Global Internet Radio. Bye-bye. Thank you, Vicki.
Thank you, Diane.